It's time for another new Kansas City Spotlight. Here's your host, Lauren Scott.
Nearly 40 million Americans are impacted by migraines and depression, but there are ways to cope. I'm Lauren Scott, your host for Kansas City Spotlight, and today I'm joined by former co-host of The Doctors, Judy Ho, and the chair of the American Migraine Foundation, Dr. Larry Newman, who are going to help us understand the connection between migraines and mental health. Good morning to you both.
Morning.
Good morning.
Do many patients who suffer from migraines come to you and proactively mention their migraines and their relationship with their mental health?
Many of my patients suffer from migraine in addition to a mental health condition, and they don't really feel comfortable talking about it. The recent survey from American Migraine Foundation, which looked at the opinions of 1,100 patients that suffer from migraine, found that more than 3 out of 4 of them worried about the stigma, this negative perception of migraine, and they didn't really want to talk about it with their physicians. And that's really important because then they're left to sort of suffer in silence. They don't know the effective ways to manage it. And because there is such a strong mind and body connection, migraine experience and their mental health oftentimes influence one another.
How can managing mental health also help with managing migraine?
If they're having a stressful day, or if they have clinical symptoms of, say, anxiety or depression, those are risk factors for triggering a migraine episode. And then once the migraine episode sets on, it brings about more stress. And then that can compound and influence that migraine experience, stretching it out from maybe a migraine episode that might just be for a couple of hours to all of a sudden now they're dealing with a migraine over a couple of days.
Tell us about the Migraine and Mental Health Connection Survey and why it's so important.
We saw that people with migraine who got their mental health under control did better with their migraine, and people who had mental health conditions and took care of their migraine got their mental health conditions under better control. So they are related, and they're important to address both. In fact, in that survey, more than 90% of the healthcare professionals and more than half of all the people living with migraine felt that it was really important for their clinician to understand that the migraine management needed to be individualized. It needed to encompass both mental health aspects and migraine management.
Okay, where can people go if they want to learn more?
Well, they can go to our website, American Migraine Foundation Dr.
Thanks so much.
Thanks so much.
This Kansas City Spotlight has been paid for by American Migraine Foundation with support from Biohaven Pharmaceuticals.